Hi class, welcome to my presentation on empowerment. So nursing leadership, what are leaders? Without nurse leaders, individual nurses would carry on with their roles independently, and would likely miss key opportunities for communication, growth, and education. By bringing the treatment team together, nurse leaders verify that each nurse is obeying the same high standards of quality and safety. Evidence-based practice is a technique that brings together evidence from research, clinical proficiency, and the preferences of patients in implementing better healthcare procedures in the medical sector, especially in nursing. However, for many years, evidence-based practice has faced many challenges that have not been sorted, hence demanding for a change that can be initiated by nurse leaders. We are constantly mandated with the task of making sure that nurses apply evidence-based practice in our daily duties in the best way, for the best way of enhancing healthcare, while also motivating them into working. For many years, evidence-based practice has faced many challenges that the intention is not to ensure that there is control over these barriers, but rather develop means of tackling the complex uncertainties that these hindrances bring about. The reason behind this is that when there is stability, it does not imply the lack of problems, but rather the lack of ways of handling issues once they arise. The basic necessity at the moment is ensuring that there is a more innovative way of tackling problems, while at the same instance providing healthcare that is effective for patients. Therefore, nurse leaders have the task of ensuring that they bring the nurses who are committed to evidence-based practice, where they can always come up with new ideas. As nurse educators, we play a pivotal role in strengthening the nursing workforce, serving as role models and providing the leadership needed to implement evidence-based practice. Nurse educators are responsible for designing, implementing, evaluating, and revising academic and continuing education programs for nurses. Nurse educators play a major role in establishing unit-based culture. So what does that mean? In which is the nursing practice guided by evidence. To do this, we must establish expectations that are supported by our departmental policies and that encourage clinical nurses to actively incorporate evidence in their daily decision making. This can produce some challenges. As leaders, we must overcome these challenges, such as lack of time, inadequate knowledge, the lack of skills, or lack of mentors, and of course, having resistance to change by others. To achieve the best outcomes through quality care, we must utilize all available talent and we must inspire, involve, empower, coach, and lay the foundational expectations that everyone is to participate. Coaching supports the staff so that they can embrace opportunities as they arise. This helps create a shift in the culture toward looking for continuous ways of improvement, and it fosters practice autonomy and contributes to an environment in which the practice is based on research and evidence. Nurse educators have an influential role on the implementation of evidence-based practice in terms of providing that support and culture for that environment. For this, we need to have an underlying knowledge, but also be aware of and address barriers to that implementation. and understand the key role of nurse educators in creating and supporting an optimum environment. All right, well, thank you for listening to my presentation. These are the references from the article, Caterpillars to Butterflies. Thank you.